Welcome to East Meets West, an integrative approach to men's health. My name is Michael Johnson. I am an acupuncturist and co-host here, and I've been practicing for 15 years with a lot of focus on a lot of different conditions, including men's health, which is what we're here to talk about. And I want to introduce Dr. May, our expert in men's health here. Dr.
Hey
May, tell
guys.
them about you.
Yeah, Dr. May here. I'm a naturopathic physician, board certified in endocrinology with, again, like Mike, 15 years of experience, clinical experience. And I mostly treat hormone conditions now. So a lot of low testosterone in men. Also treat some women too, but my passion is men's health. So excited to kind of talk through cardiovascular disease today because it still is the number one killer in men. So this is a big part of men's health, especially as we get older.
So it's going to be a killer episode. That's bad.
Oh boy.
And by the way,
Started.
Dr. May talked about testosterone. If that's something you're interested in, check out our previous episodes because we have a couple on it. So,
Absolutely. All right.
and Dr. May,
Hmm?
tell us about cardiovascular disease. You said it's the number one killer.
Yeah, so based on age categories, it's either number one or number two for most men. Overall, it accounts for 24.3% of all deaths in men. Cancer's a little behind that at 21.6%. And that was based on a study published in 2021. Now, if we go by sort of age categories, once we start getting into like mid 40s in men, cancer's a little bit higher at 24.2%, heart disease at 24.0%, and that continues into 60s and 70s. Cancer is still a little bit higher than heart disease, but once you hit your 80s, now heart disease kind of takes over as number one significantly. It's 30.1% versus 14.8% in cancer. And so it's like, there's this transition here where it's still at the top of the list. It's just cancer, like mostly prostate cancer and colorectal cancer are going to be up there as far as the leading cause in those age categories.
That's really surprising to me. You mentioned like 40s into 50s because a lot of people don't think that you have to worry about anything cardiovascular if you're under the age of 60. I mean, at least in the generations I've known, it's like, okay, if you're not 60, not anything to worry about.
Yeah. They've done some interesting studies on young men who die, especially who have been like super active, they're athletes, even like into their 20s, and if they've had some alcohol use and stuff like that. Basically, what they've done is through autopsies, they can see actually early stages of cardiovascular disease already then, like in your 20s. And
Wow.
so this is a process that just doesn't happen overnight. It's going to take decades to form or to progress to a point where it's going to become a big issue, like a heart attack or stroke. And oftentimes that's going to happen in a guy, like a man's like late 40s, early 50s is if they have a heart attack, that's usually when we're going to see that first one.
Really?
And
That young? Wow.
yeah, yeah, I think the average age is somewhere like 54, 55, something like that.
Oh,
And
it's
the
brutal.
problem with that, though, it's a high percentage. I'm going to miss the number here because I didn't look it up beforehand, but I think it's somewhere like 40 to 50% of all first heart attacks in men are fatal. And so it results in death. And that's oftentimes the sort of first symptom that we see is a fatal heart attack. So
Yeah.
this is definitely something we've got to think about being more proactive and preventative about, because oftentimes it doesn't present with a lot of symptoms prior to being to a point where we can actually do something about it that's not like higher interventional level.
Yeah. It's actually the same in Chinese medicine. I was doing some research, and back thousands of years ago when they were diagnosing a lot of the heart stuff, which I'll go into the terms later, they actually, the first symptoms were the exact description you would expect for a heart attack. Like that's what they described as like this pressure in the chest with pain, and like they were describing a heart attack. They just didn't have the word for it. But a lot of
Yeah.
times that was their first symptom of like, okay, there's something wrong here.
Yeah. Wow, that's interesting. Yeah, and that's what I love about traditional medicine, especially Chinese medicine, is they were just so observant. So they, even though they don't have the same kind of vernacular terminology and understanding of it that we have today, they still were great observers. So we
Mhm.
still like they observed those things happening and they wrote about them, and we're just now able to a little bit better understand them.
Yeah, exactly. And they actually were one of the first cultures to do autopsies as well. So
Oh, really? I didn't know that.
yeah, they did it
Huh.
thousands of years ago. They were doing
Yeah.
autopsies.
Wow, that's cool.
Yeah.
All right. Some other disheartening numbers about heart disease or coronary vascular disease. So 350,000 men die of cardiovascular disease each year. That's like 1 in 4 deaths, according to the CDC.
Oof.
Um, and half of those men who die, like I just said earlier, so here is the percentage. I did actually write this down. Half of the men who die suddenly of coronary heart disease had no previous symptoms. Um, and then from 2013 to 2016, it's estimated that 47% of men over the age of 35 had hypertension, which is one of the leading causes of cardiovascular disease because of the damage that it creates in their blood vessels. So that's almost half of men over the age of 35 had some level of high blood pressure. And then the other thing is too, like men develop heart disease at a more significant rate and earlier than women by as much as 10 to 15 years.
Oof.
So again, that's why we see those heart attacks and strokes earlier on than we do in women.
Do you think that's more environmental or more just genetic? Like, what do you think?
I don't know. I think it's complex. It's got a lot of variables. I think guys, one, we just while we're doing this podcast, guys, we don't take care of ourselves, very well. We're not very proactive and preventative like women. I mean, if you look at the typical patient in functional medicine or naturopathic medicine, I mean, it's vast majority are women, and they're
Mhm. That's
women,
true.
starting about 35 to 40 when women start becoming very proactive about their health, up until like their 60s or 70s. Like that's the vast majority of patients in these sorts of clinics. A very small percentage are men, and that's
Yep.
just because we classically just don't do well with taking care of ourselves, whether that's part of our culture of being like strong or being men. We don't ask for help, and so we just kind of grin and bear it and just try to push through it. And some of these things you just can't push through. And
Yeah. I would agree with that. And I have also noticed that if somebody does come to me who's a guy, a lot of times they're referred by wives, girlfriends, somebody else. And
mhm,
also, like, they'll downplay their problems. I see
yep,
this a lot, and I guarantee it contributes to the heart issues because I asked somebody what their blood pressure was last time they got it checked. Well, it
mm,
was actually pretty good for me. Well, if you ever hear those
mhm,
words, you already know, like,
yeah,
they need to do something about it. It's pretty good
mhm,
for me. It was, 160 over 110. It's pretty good for me. It was, fairly low.
yeah,
And I'm like, you really need to work on that. Oh, no, no, it's fine. It's like, it's right
mhm,
on the edge, but it's not that bad. It's like, no, it's not on the edge. Like, get this
yeah,
taken care
yeah,
of.
yeah. You're smack dab in it. You're not on the edge.
But people don't realize, right? You just think like they check my blood pressure every time. They say
Mm,
it's a little high, but I'm still young. Like I'll do some natural stuff and see how it works. And by the way, I'm not insulting natural stuff, but
right.
like when you start getting into numbers that get scary and are causing major issues, like
Mhm.
there needs to be further intervention, in my opinion. So,
Yeah, I do that a lot too. When guys when blood pressure gets to a certain level consistently, then we're past that point where natural stuff is going to help. And so I see this play out a lot in my practice where I actually have to put them on a blood pressure medication for 3 to 6 months. And that buys us some time to start doing all those other things, diet and exercise and supplementation and things like that, that can sort of naturally bring that number down. That way, and you'll see that if they're really consistent with it on the medication, those numbers will really start to drop pretty significantly and pretty fast. And then we start titrating that dose of the medication down and then eventually off and see if they're able to maintain those good numbers with all the natural stuff. And a lot of times it works great, but you're right. Like when people get up to, or guys get up to those numbers, like it's just too dangerous. You're just a walking time bomb, and you
Yeah.
just don't know. There's just the unknown of not knowing like how progressed this is, how significant it is. Are you going to stroke out tomorrow, or is it going to be 2 to 5 or 10 years before that happens? Um,
Yep. I mean, I remember when I was in Alaska, somebody didn't even know they had high blood pressure, said their heart was
mhm.
fine. They had their blood pressure checked while we were there, and it was 220 over 160.
Oh wow,
And it was just like, yeah, you're taking a trip to the hospital.
yeah.
Like, but they had a headache. That was their only symptom, is like, I got this headache.
Hmm.
I don't really know where it's from. And then, you checked and there were no other symptoms. This has probably been going on for years and it just never
Hmm.
got checked, and it escalated. And by the time you get to that point, there's all kinds of chances for damage. So as we
Hmm.
usually say in this show, get your stuff checked. Like, go to the
Yeah.
doctor, get it checked regularly. Check it at home if you need to, but just get a good idea of where you're at so you know what you can do to be healthy.
Yeah, that's a great point. I mean, even if you don't want to go in to see your doctor, like go get a blood pressure cuff at a local pharmacy and just start there and take it a couple times a day. Take it first thing in the morning when you wake up, and then take it another time later in the day, like late afternoon, early evening, and just see what those numbers look like on a consistent basis. And if you're getting in that 130 over 80 or above those numbers, you really need to start watching it more closely. And because there
So
are
is that your
different
magic number?
yeah, 130 over 80 is kind of the newer numbers now. Where we can tolerate a little bit higher numbers for the systolic, which is the top number, but it's the diastolic number that our bodies just can't tolerate a higher pressure, because that's the pressure in your arteries when your heart is relaxed in between beats. So if it's higher, we can do more sustained damage.
Hmm.
So it's just like watch those numbers, and if you're consistently above that, then you need to get checked out. And but monitoring at home is a great first step. And then if your numbers are kind of borderline there, play around with it. Start changing your diet, exercise more. Make sure you're getting good sleep. All the stuff we're going to kind of talk through today, and then
Yeah.
see if those numbers change at all. If you're doing a lot of work and effort and you don't see those numbers change, that's a big deal. Like you really need to get in and get it further evaluated, which I know a lot of guys don't want to do. But this idea that we have to be tough and just kind of grin and bear it and take it on. I mean, we got to get past that, because you're no use to anyone if you're dead. So,
Yeah.
if you think you're doing this for your family and your kids and you got to provide and you got to work and that sort of thing, well, what's going to happen when you're gone? You
Yep.
know, it's like, yeah, yeah, we just got to get over that.
Yeah. What you don't want on your gravestone if you die at 48 was, I was tough. Like,
Right.
I toughed it out.
Yeah. Yeah, exactly.
Instead, like, get help now, make it to
Mhm.
your 70s, 80s, spend some time with your grandkids or kids or loved ones or your pets or whoever you like.
Yeah. Yeah, absolutely. And
So
it's
you're
like,
go ahead.
at the end of it all too, like, how much of it are you gonna say, like, on your deathbed, like, "Man, I wish I would have worked, 80 hours a week instead of, 60 hours a week." And, it's just like, at the end of it all, like, how much does it really matter? You know?
That's a good point. And we kind of jumped ahead a little bit, but you mentioned it some when we were talking there. As far as cardiovascular health, like, what kind of things in your life affect blood pressure, affect cardiovascular health? Like, what
Mhm.
activities are really going to be affecting that?
Yeah. Well, it's everything, right? It's everything we always talk about every week. And it's a lot of different variables. So it's your diet, the junk that you're eating, it's, your lack of exercise, it's your poor sleep, it's all the environmental toxins and junk that we're exposed to on a daily basis that increases oxidative stress and inflammation and all that kind of stuff. It's smoking, it's poor air quality. All those things are going to contribute to that stress on our system, which is largely going to play out as cardiovascular damage.
Hmm. So, speaking of smoking, like I've always been curious. I know a little bit about it, but why is smoking so bad for cardiovascular health? Because when you think smoking, you think it hurts your lungs. So, why is
Mhm.
it bad for your heart?
Yeah, it all comes down to oxidative stress. So oxidative stress is kind of the same process that happens when metal rusts, right? It oxidizes. That same process happens inside your body. It's what causes your body to age and those cells to age and be destroyed, as we live. So we want to limit as much of that oxidative stress as we can. And this is where antioxidants come into. If you've ever heard that term used, like vitamin C and vitamin A and some of those others that we call antioxidants, that's what they do. They help to kind of calm down or quelch that oxidative stress. And smoking is just one of the things that can increase oxidative stress the most per like
Hmm.
time. And that's why smoking, inhaling that stuff, poor air quality. We practiced in Fairbanks, Alaska, some of the worst air quality in the world at certain times in the wintertime, right? It's like all of
Mhm.
that's going to create a massive amount of oxidative stress on your system, and that stress is going to damage the inside of your blood vessels. It's called the endothelium, and that's where plaque formation occurs.
Hmm. Interesting. And it's actually very similar to Chinese medicine, as usual. We say this every single week, but
Mhm.
the lung and the heart are connected in a lot of ways, and also the heart and the kidney. And so, if you're having something that's damaging your lung, it's eventually going to hurt your heart. If you're going to have something that's damaging your kidneys, it's going to eventually hurt your heart, and vice versa, because they're all
Mhm.
connected in different ways. And
Mhm.
I find that interesting because there really is a connection, with the smoking and heart stuff, but then also with kidney issues and vice versa. High blood pressure can damage your kidneys if it's very, very high for a long time.
Yep.
And
Yeah.
people don't realize that they end up with kidney failure and they never realize they had hypertension.
Yep. Yeah, they call it the silent killer for a reason. Oftentimes, people can go years to decades and have high blood pressure and not even know it. Sometimes you might get a mild headache, but people can have mild to moderate high, blood pressure without any symptoms.
Yeah.
And so imagine I mean, just imagine like a house with just kind of old pipes, and it's like if you increase the pressure inside that closed system for a period of time, something at some point is going to fail, right? Something's going to give out. And so we often see that in smaller blood vessels, which are going to be like in your kidneys or your brain or your heart. And those fail. And when they do, that can be pretty significant. So, yeah, it's again, it's all about prevention. And back to the smoking kind of point too. Like, I mean, just studies that have looked at smoking and risk of cardiovascular disease. I mean, it's a really consistent model that's been looked at, and we see at least a minimum of a 2x increased risk of
Oh,
cardiovascular disease with smoking. And,
that's awful.
and yeah, it's pretty bad. And let's see, like, for sudden cardiac death, specifically, it's a threefold increase in relative risk among smokers versus non-smokers. So
Wow.
that risk of having that fatal heart attack, like first off, is three times higher. So again,
Yeah.
it's significant.
And I've seen this firsthand. One of my best friend's dads died at 48 years old from a
Mhm.
massive heart attack. He was just a teenager, no idea anything was wrong, smoker,
Mhm.
and going to the courthouse just dropped. That was it.
Wow.
Instant. And you would have never figured. So, not to scare y'all who are listening, but get stuff checked. I mean, it doesn't hurt to check your blood
Yeah.
pressure. It doesn't hurt to talk to Dr. May or someone and see, like, is there something I can work on now while I'm a little younger, while there's not issues, even if you don't have a problem, to make sure you don't get to this place.
Yeah. I mean, I kind of do want to scare you a little bit. Like, but a little bit of fear could be pretty a healthy motivator, right? And that often does, like fear and pain are really good motivators to get things done. And guys, we suck at getting things done like this when it comes to ourselves or taking care of our health. Like we
Yeah.
really suck for the most part. And I think we need a big kick in the butt here, because
No, we do.
this is not getting any better. Like, stats are just worsening, and
Yep.
so it's like, what are we going to do to change the course of this? And especially, you know, if you don't even think about it in yourself, think about if you have kids, especially boys. Like, I have 4 boys. You've got a couple boys. Like if you don't even think about yourself, think about changing their, scope in life. Like, what are you going to do habit wise and information wise to teach them, so that when they get your age, they're not having to deal with the same issues that you're having to deal with. We think about
Yep.
that in terms of like finances and education and stuff like that, but we don't think of it so much about health, right? Like, what sort of, strategies and habits can we pass down to them so that they are healthier at our age than we are, right?
Yeah, and I'll tell a little story before we move on. So when
Mhm.
I first saw Dr. May as a practitioner in Alaska, that was actually one of the first questions you asked me. You probably don't even remember, but you were looking at family history. My family history is terrible, horrible, horrid. Like
Mhm.
everything that can go wrong has gone wrong. Cancer, early
Mhm.
strokes, heart disease, everything. And I was just like, yeah, I guess I'm just kind of screwed, you know? It's like everybody dies young. And you're like,
Mhm.
well, like you were not only asking like, well, do you not want to live longer? Like, yeah, I do. It's like, well, there's things we can do, but you're
Mhm.
also asking like, what kind of quality do you want as you age, like as you live longer? And you focused a lot of time on those questions, which I think are really good because so many times I was the typical guy. I was just like, well, if it happens, it happens. There's nothing I can do about it. You know, say Levy.
Mhm. Yeah.
And you focused a lot on just like, okay, how do we change this trajectory? You know, you have this genetic component, but that doesn't necessarily mean it has to be turned on.
Yeah. Well, yeah, you're totally right. And that's where I think getting down to the crux of it is, what do you want? Like, as a guy, like, what do you want in life? Do you want to live it up, live it hard, live it fast, and die young? Okay. I mean, this is your life. Like, do with it what you want. But if you want to live a long, healthy life where you don't have a lot of disability, you don't waste the last 20 years of your life, being stuck in a wheelchair or a chair, and you're just disabled, or you're not able to do the things that you want to do. So those last, 2 decades are just miserable. Like, what do you want that to look like? And
Yep.
some of this is some delayed gratification, right? It's like, what kind of work can you do now to create that life later on? Same with like finances, right? Like, if you want to be well retired, like, you've got to work your butt off right now, and you've got to put in the work so that you can reap the benefits later on. Same happens with your health. I have a colleague who, his little catchphrase for the longest has been accumulate health. And early on I was like, that's kind of weird. I don't know about that. But now that, like, I mean, he stuck with it too for years and years. I'm like, man, that's a great way to look at it. You do accumulate health, but in order to accumulate it, just like wealth, you have to be persistent and
Yep.
consistent with it, and just, understanding that sort of delayed gratification. Yeah.
And habits, man. Like I'm actually doing a class with a master class with the guy who wrote Atomic Habits. Great book. Atomic Habits is a great book,
Mhm.
but it talks about changing your habits and how daunting it can be, and like make it easy, make it something achievable, and start small. So
Yeah.
if you guys are at a place where it's like, yeah, I know I have higher blood pressure than I should. What should I do? It's like, start with small things. Start with things you can control, and also talk to a doctor you trust. If you don't trust an MD, then talk to a naturopath like Dr. May. Like, talk to a doctor you trust who can help you manage and track, because it's a lot easier to track with help than without.
Right. Yeah. Yeah. Well said, man. All
All right.
right. Anything
So
else from
somebody,
a Chinese perspective as far as like assessment goes?
yeah. So unfortunately, a lot of the assessment in the old days was just like, you have this crushing chest pain and it feels
Mhm.
congested. What do I do? But there are some lead ups to that. So a lot of times you're going to check liver stuff, which when we talk liver, a lot of times we're talking about stress and anxiety and everyday things, and your sympathetic nervous system's through the roof. And so that's one of
Mhm.
the precursors with Chinese medicine. Like, you want to keep the liver down or it can damage the heart. which makes
Mm.
sense when you look at stress, anxiety, sympathetic nervous system activation.
Mhm.
So, before it gets to those points, you really want to keep an eye on that. And also diet is a huge thing. Good diet, exercise. If you're overweight, exercising and getting your diet right is going to be a big component. Part of Chinese medicine, they actually call it phlegm and dampness in the heart, which I find very interesting if you think about blockages in the arteries, because the 2000 years ago, they were saying it's this damp phlegm that's stuck, that's basically making it where blood can't flow. And if you
Mm.
look at cholesterol and artery clogs, right, it's like this
Yeah.
dampness where things can't flow. So I find it really interesting.
Wow. Oh, that is really cool. And
Yeah.
and two, like, just to clarify, you were talking about sympathetic nervous system activation. So just a little bit about if you're not familiar with those terms. So part of your autonomic nervous system, which is the part of your nervous system that's always just automatic, right? It's just working in the background. You don't have to think about it. You have to be intentional about directing it. Is made up of two parts. It's your sympathetic and your parasympathetic. So the kind of easy way we can remember those two is sympathetic is your fight or flight. So it's that stress part of it. And parasympathetic is like rest and digest. So it's like the really calm down kind of version of it. Now we want a nice balance between those two, and we want to activate those when we need to. So most of the time we should be in a parasympathetic state. But, in periods where we're stressed out, we need to run from the bear kind of situation, we need to jump into sympathetics, really quickly and easily. And then once that trigger is gone, we're back to parasympathetics. So what the problem today is we spend a lot of time in sympathetic mode. And what that does to your cardiovascular system is it increases pressure. Because think about if you need to run from the bear, you need your blood pressure to go up, your heart rate to go up. You need to pump blood out
Mhm.
quickly to your muscles so that you can run, right? And so there's an increase in pressure for a specific reason. And that's fine for that period of time, but if you think like if you're in that state all the time, you're just stressed out and your
Yeah.
body feels like it's running from the bear day in day night and night, then obviously that's bad. That's too much pressure in your system for too long. And just like that sort of pipe in the house analogy I used earlier, something's going to burst. Something's going to break eventually. And so
Yeah.
that's kind of just to clarify the sympathetic
No,
stuff a
thank
little
you.
more.
Thank you. Sometimes I forget. And something else, that's common sense is like if you're wondering, like, is there really anything to this, like high stress, sympathetic stuff?
Mhm.
Think about every healthy person you've ever met in their 80s or 90s, and think about if they're a giant stress ball who's chain smoking and worries about every little thing and is just miserable. Most
Mhm.
likely, if they're healthy in their 80s, you haven't met those people. they're
Yeah.
usually like they take life as it comes, they work out, they eat well, and they're not super high stress.
Yeah. That's a great point. I was curious about this, so I kind of did some digging on some numbers on stress and cardiovascular disease in men. Let me just throw out a few things here. So, men who experience either job strain or what's called an effort reward imbalance. So, we know we have to work hard, but if that reward that we get from that job is less than the effort that we're putting into it, that becomes a stress on our system. And what the study showed was this imbalance created a 49% increased risk of heart disease compared to those without those stressors. So
Mm,
that increases 50%. Okay. Um, a separate study found that depression and anxiety, which also obviously can be related to stress, increase the risk of major cardiovascular diseases like or events like heart attacks or stroke by 35%.
oof.
And the kicker here, so get this, guys, listen up, because I'm definitely guilty of this. We tend to have kind of more short fuses, and we build things up until eventually they burst, and we get this angry outburst. And listen to this. This study showed that in the 2 hours following an angry outburst, the risk of heart attack is nearly 5 times greater, and the risk of stroke is 3 times greater.
Yep.
Yeah, just think about that for a second. Okay. It's like And that's usually because we're not very good at stress management and doing things to try to alleviate stress. So we let it build until at some point it's going to burst. And at that point, your risk of heart attack and stroke goes up significantly.
Yep, and I've actually seen this in practice. I've seen people when I ask what came before their heart attack or stroke, it's like I got really mad and I was
Mhm.
like screaming angry and then it happened. I mean, I've seen this before. It absolutely happens.
Yeah, yeah, absolutely.
It's a good point.
All right. Yeah. All right, man. Let's see what else. Let's anything else before we kind of jump into treatment strategies?
Yeah, one other thing I was going to ask you, maybe this will be included in treatment strategies, is like, what does your typical workup look like? If somebody comes in, they have high blood
Mhm.
pressure, they're in their, mid 40s, late 40s, like, are you going to do a full workup or are you just going to say, okay, your blood pressure is a little high, let's put you on medication, get it down?
Yeah, no, that's a great time to do a full workup. If you're seeing signs of any sort of vascular issues and blood pressure being one of those, that's a great time to go ahead and start. Now, I'll tell you, like, guys, when you're in your 35, 40, especially like early 40s, this is a great time to just go ahead and start getting these labs done, regardless if you have symptoms or high blood pressure or not, just because it's a great starting point and a baseline for you to look at as you get older. So as you hit that 45, 50, 55, like you can see if these numbers change over time, and then you can get a better idea of what your individual risk is versus populational risk. Okay. Because a
Oh,
lot of
that's
these
good.
things, like, we'll look at numbers and stuff and like, oh, yeah, once you hit this number, you're at an increased risk. But what if your number was significantly less than that and you've just jumped up to that over the last 2 years?
Mhm.
It's like, well, we know then your individual risk is higher during that little period of time. So
It's a great
anyway,
point.
yeah, track your numbers. We talked about this with testosterone and stuff, but this applies to a lot of different labs, and these labs, they're really cheap now. You can get a bunch of these for 300-400 bucks, total. It's like once a year, once every 2 years. Like that's not much of an investment to get that sort of peace of mind and be able to track those numbers. But anyway, so let me jump into some of the labs
Yeah.
that I like to do. So I like to look at some inflammation markers. One's called a high sensitivity C reactive protein. This is one specific for your vascular system. So it's going to give us a great idea if there are signs of inflammation in your vascular system. And this is one of the key risk factors when it comes to cardiovascular risk. We often kind of talk about cholesterol and like, hey, how is your LDL, your bad cholesterol, and is it high? And that is a potential risk for cardiovascular disease, but really it's the damage to your blood vessels that increases your risk the most. And that usually comes in the form of chronic inflammation, high chronic blood sugar, and what's the other one? Oh, blood pressure, like we were talking about.
Mhm.
So those are the three things that typically damage your blood vessels. And then your body uses that LDL cholesterol and platelets and other things to sort of repair that. So it's like when you get a cut on your hand and your body forms a scab, that same process happens inside your blood vessels. Just imagining that over the course of 20, 30 years, you can imagine that scab eventually becomes an occlusion in an artery, and then you're in trouble. So anyway,
It's a
the
great
the
point.
C-reactive protein is a great one to start with. Homocysteine, which looks at it's a methylation marker, and I won't go into too much detail there, but it's another good risk factor. You can do advanced lipid panels. So this is where like the standard LDL cholesterol and HDL and your total and your triglycerides, which is kind of the typical lipid panel, may not be enough, especially if you have a pretty strong family history of cardiovascular disease. You may want to dive into this a little bit deeper, and this advanced lipid panel goes into like lipoprotein, particle size, and stuff like that. I won't dive into too much of that, but it looks at your LDL and your HDL cholesterol differently. It looks at the size of the particles, which gives us a better idea of what your risk is. More so, you can look at other markers like ApoB, and so apolipoprotein B, and think of this as like the bus that carries your LDL cholesterol around in your blood vessels, in your
Mm.
arteries. So we really want to get I think data is really starting to show now it's a much more sensitive marker than LDL cholesterol is now. Because you think on the highway, if you've got a ton of buses versus just a ton of just like commuter cars, that's a different sort of situation, right? And
Mhm.
so you can carry a lot more LDL cholesterol inside those buses. And so we want to make sure like you just don't have a lot of buses floating around. And that's where the ApoB comes in.
Oh,
Um,
interesting.
yeah. So, and then there's some other ones too. You can kind of go down this rabbit hole pretty deeply. There's LP-PLA2. It's like a plaque enzyme, and then LP little a has to do more with like familial risk, like family history. There are some genetic markers that you can test for this, so it can get pretty in depth there. But as far as the basics go, I would start with CRP, homocysteine, an ApoB. Look at your blood sugar, because remember that's the other risk factor. So look at a hemoglobin A1C and an insulin level. Both of those need to be done fasting.
Mhm.
Um, Hormone wise, testosterone and estrogen, like estradiol is the main estrogen you're going to look at. I always look at the ratio between those two. So if you divide your testosterone by your estradiol, you want to be about 150 to 300. If you're below that, you know that your estrogen is higher relative to your testosterone, and that could potentially increase your risk. And then some nutrients that are really vital are vitamin D. We always keep coming back to vitamin D for a lot of things because it just does
It's
a lot
amazing.
of
Yeah.
yeah. And then especially low risk or high risk of low vitamin D. And then magnesium. So magnesium does a ton of stuff in the body, just like vitamin D. It's like involved in over 300 enzymatic processes in the body, and it's a really potent vasodilator. So it helps to dilate blood vessels. And so if you're deficient or low in magnesium, that could play into high blood pressure. And I've seen plenty of cases over the years where guys come in, they're deficient in magnesium, and we get their levels back up to, a good level, and their blood pressure drops. And so again, an
Nice.
easy kind of strategy there.
Cool. Thank you.
Uh,
And
yeah.
we'll get into treatment strategies here in a second. I know we're going a little long, but I do want to tell a personal story just from my life to kind of give some perspective to what you just said, because it's all absolutely true. So my mom, she had her first stroke at 48. And she ended up having heart problems as well. But everything you talked about was exactly what was going on. Like high stress job, she didn't
Mhm.
like, type 2 diabetes, not well controlled, no diet, no exercise, obesity. Like everything you can think of was there, but it was just like, well, I'm on the medicines I'm supposed to be on and it's fine.
Yeah.
And there was no lifestyle change. And even with all the medications, still had this major stroke after a very angry event where she was screaming. And
Mhm.
so, just to give a little bit of a personal perspective, and she lived for a lot longer, but her life was much harder. There was disability and other stuff because
Mhm.
of that. And she had a real suffering quality of life. So, as we go into treatment strategies, even if you're on medications right now, that does not mean you don't need to be doing anything. I know we're scaring y'all, but there are still things you need to be doing in your life that the pill you're taking is not necessarily going to do for you. So,
Yep.
with that, let's look
Absolutely.
at treatment strategies.
Okay. All right. Well put, Mike. All right. So when it comes to treatment strategies, I try to make this as simple as possible. And you probably, if you listen to our podcast, you've heard me, talk about this before, but it's something what I call the core four, which is your diet, your nutrition, your sleep, and stress. And so most of our chronic degenerative conditions are going to boil down to some or all aspects of those four things. And so I typically talk about those as sort of the foundational pillars of our health. If you can be really intentional about what you do in those four categories, you're really going to set yourself up for success in so many different areas as far as prevention. In cardiovascular disease, prevention is no different. So, as far as diet goes, you know, I think at this point, it's probably less of a knowledge or informational, thing than it is just about an implementation,
Mhm.
aspect. I think most of us know what a healthy diet's supposed to be, right? Now there have been lots of studies done on this, and over again, really the Mediterranean diet kind of shows the best as far as prevention goes. Like over and over, and this has kind of been studied ad nauseum at this point. But basically, a Mediterranean diet or a plant-based diet are going to be your best bets as far as the most significant reduction. I
Mhm.
think the Mediterranean diet, let's see, it was a 31% decrease in cardiovascular disease over like a 5-year period, one study showed. A plant-based diet showed that this was over a 32-year period. Those who, and this is kind of progressive here, like those who had the highest plant-based diet had the lowest cardiovascular disease risk. And the
Wow.
difference between the high and the low aspect was 52%. So basically what they're saying here is the more plants you eat, then the less sort of meat and stuff, the better outcomes you have, and vice versa for decreased outcomes. So that's as far as diet goes, like that's the basics of it. A
Yeah.
DASH diet, which has to do with like again, more plants, less meat. It's basically the diet that was created for hypertension, and really all it's doing is increasing your potassium levels and decreasing your sodium levels. And most of that's done by a plant-based diet. And so, I like Michael Pollan's sort of take on this, like eat real food, mostly plants, make it simple. Like this doesn't have to be rocket science, right? It's just you just eat real food, eat food that doesn't have a shelf life of like 3 years, right? And eat it as fresh as you can, eat it as local as you can. So, like, talk to your local farmers,
Mhm.
get fresh, um, fruits and vegetables in the summertime, get,
CSAs, y'all.
yeah, CSAs, great thing to do. And then even for the meat aspect, like talk to your local farmers too and get good
Mhm.
quality beef, and go hunting and get your game meat and stuff like that. Like again, whatever you're going to eat, like that's where you start first, is quality, right? Get the best
Mhm.
quality you can, get real food, stay out of the middle of the aisles in the grocery store, stay on the outside where all the fresh stuff generally is. Even if it has to deal with grains and stuff like that, you still want those fresh.
Yeah. No, I like that. And it's actually very similar to the Chinese recommendation for heart diet. It's funny, it's like forever ago. And what they say is lots of greens,
Mhm.
like good fruit, good vegetables, good whole grains. And if you're going to eat meat, good lean meats or seafood. Those are
Mm,
really their focuses, and healthy fats. So
mhm.
they don't say no fat, they say healthy fats.
Yep.
And so, anyways, it's very similar. I always, every single week we say this, but I find it funny that something from thousands of years ago is similar to
Yeah.
what we're looking at now.
Yeah. Again, they're great observers, right? And so they figured this out a long time ago. Now I get lots of questions about, oh, I want to do keto so I can lose a bunch of weight, which is going to decrease my risk, and or I want to go carnivore, and that's going to do the same thing. And we kind of have to look at those diets in a different light. Those aren't diets that we can sustain.
Hmm.
So it's like you can't do keto forever and you can't do carnivore forever. I think those can be used as a tool to help move you in a direction that's better, and then transition into a diet that's more sustainable. I think that's why the success of the Mediterranean diet has been so high, is because it is a diet that people can sustain for their entire lifetime. And it's
And it's
not kind of
delicious.
a fad-ish type, diet. So,
Yeah, and something else before we move to the next pillar is, if you're overwhelmed by all this, let's say you've listened to all this and you're like, oh my gosh, I cannot implement all this. Like, I'm busy. I just want to go to McDonald's. Can y'all shut up, please?
mhm,
Again, back to habits. Start with one or two things. Go for the
mhm,
lowest hanging fruit of, like, okay, you're drinking, a liter of soda every day and you're eating dessert multiple times a day. Well, these are
mhm.
nice low hanging fruits you can start with. Like, start
Yeah,
with those, get that habit established, and then move into the next.
yeah,
This doesn't have to be overnight, but do something. Don't just let it
yeah,
shut you down.
yeah. I remember when I was in my clinical rotations, and I was the sort of primary student clinician, and we had this guy come in, and he was just a mess. I mean, he was extremely overweight, obese, high blood pressure. He had an autoimmune condition at the time too, and he was a mess. You could tell he was literally a ticking time bomb,
Hmm.
and he had so many things going on. I went to my supervisor like during that visit, and I was like, where do I start with this guy? Like, it's just I don't know. Like, he needs a dozen different things right now. How do I not overwhelm him? Because you could tell too in the visit, like he was very overwhelmed, just didn't know what to do. Um, and so the guy, my supervisor, gave me some great advice. It's like start really simple.
Mm.
And so we started with water. Like the guy was super dehydrated. So it's like, hey, I want you to drink this many cups per day for the next 2 weeks. And then I want you to come back and let's see how you're doing. And every time he would come back, every 2 to 4 weeks or so, we would change a little something different. The next time it was, what vegetables do you like to eat? Oh, okay. You like those 3 or 4 different vegetables? I want you to eat those every day, this amount for the next 2 weeks, and then come back. And over the course of 3 months, this guy lost almost 50 pounds and
Oh,
just
wow.
completely changed his life just because we just like incrementally made those small little changes that over a 3 month period. I mean, that's not much time at all in the grand scheme
Yeah.
of things, even incrementally like that. And so it's like, yeah, you don't have to do a ton right now. You have to know like what you can do and be realistic. And that's where if you've been a patient of mine, like you've heard that, spoken a lot. Like what's realistic? Like let's not waste your time and my time creating these goals and strategies that you're not going to live up to. So let's find something that's actually realistic.
Yeah. I like that. It's like, don't tell me you're going to go run a marathon when you haven't run it all in the last year. It's
Yeah.
like, let's start small. You can work up to a marathon, but let's start with a mile first and see how you do.
Yeah. All right. So let's jump through these other ones kind of quickly because I know we're kind of stretched on time here. But exercise wise, come on, guys. We all know that we need to exercise more,
Yep.
but there and the benefits are progressive. So we know that 150 to 300 minutes per week of moderate intensity can decrease your risk of dying from all causes, not just cardiovascular disease, but everything by 20%. And that's just 150 to 300 minutes per week. So it's not much. It's like what 20 minutes a day is 150,
Or
something like
30
that.
minutes, 5 days a week.
Yeah, right. If you do 300 to 600 minutes of moderate intensity, now you're up to around 30% lower risk of death. And then if you hit that 600 minutes per week, then you're getting up into the 40% plus. And so you can
Wow.
see it's a progressive incremental increase in or decrease in risk as you go up in minutes. And it doesn't have to be high intensity. This is all, moderate intensity exercise.
That's good stuff.
Yeah. Sleep, real quick. So, sleep apnea is really the biggest thing here. We know that if you have sleep apnea, that increases your risk of heart attack by as much as 140%. So, that's huge. And this is one I've seen, early on in practice. I'd see occasional sleep apnea in guys, but now I don't know if we're just diagnosing it better or it's just more, we see more frequency of it, but I am diagnosing sleep apnea in guys all the time. And especially if I see a guy with low testosterone and he's otherwise healthy, then sleep apnea is kind of the first thing I'm looking for.
And that's also funny from a Chinese medicine perspective because sleep is associated with the heart in Chinese medicine.
Hmm,
They're
really?
connected. Yeah. So if you're having sleep issues, you actually look at the heart as part of
Hmm,
it, and because they believe and they look at it affecting each other. So
yeah.
interesting.
Yeah. Well, you think I mean, it's as far as obstacles to good health, that's at the top of my list. Like if you're not sleeping, then you're not repairing, you're not recovering. You produce a lot of your testosterone and growth hormone while you're sleeping. So then you're seeing deficiencies in those. Like there can be a lot come from just not having good sleep and being actually stressed during sleep instead of recovering.
So, sorry, I keep making us go long here. I just get excited. Tell us about the other pillar.
Yeah, yeah.
Oh, I think we lost him there, but yeah, we talked a lot today about everything. Talked about stress. Talked about everything. There he is.
Yeah. Sorry.
Oh, you're good. You got so excited.
Yeah, I know. I switched to a different screen and then totally got out.
It's all
Uh,
good, man.
so yeah, so really, stress was the other pillar, which we'd kind of
Oh yeah.
already talked about, as far as what stress can do, as far as increasing that sympathetic, nervous system tone and all that. Smoking was the other thing that we've already kind of talked about that does
Uh,
significantly increase your risk. So those are kind of the main ones. I would say, besides the labs that we talked about that you could potentially run, there is some imaging that you could look into doing as well, especially if you're in your late 40s, early 50s. You may want to consider doing an ultrasound of your carotid blood vessels.
mhm.
You can also do what's called a coronary calcium score, which is a CT of your heart and the blood vessels there to see if you have any calcification.
Yeah.
More the better one though is a CT angiography, which is another picture of it's using a CT, but it's a much more in depth look at the blood vessels in your heart, and it can give you a little bit better idea of what your plaque risk as far as rupturing goes. And that's kind of the bigger issue too. You can have plaque formation, but not all plaque is going to rupture off and break off and then travel into smaller blood vessels and occlude those blood vessels. So those are kind of three big ones to consider as far as imaging goes.
I like that. I like that. And from my perspective, a lot of it's going to be exactly the same. You focus on a good diet without a lot of processed foods. That's actually going to be one of the first things I tell people is like, okay, like you're eating a ton of processed foods, like find things you like that just aren't processed. They're real food. Like let's
Yeah.
start there. And when I say processed, canned, bagged, you look at the label and there's 36 items on it, then you probably are eating something that's not great for you. And we all do it. But
Yep.
that's where I
Yeah.
start is with no processed foods or not. I won't say no. Start to limit those is better.
Hmm. Good.
And then exercise.
Hmm. I'm curious, like supplement wise. So for me, I usually, once guys have kind of got the four pillars down pretty well, then we add supplements in and we'll focus on like nitric oxide support. So this is where your L-arginine and L-citrulline, your beetroot kind of stuff comes in to kind of dilate your blood vessels. Especially
Hmm.
if they have blood pressure issues, loading them up on those antioxidants as well, making sure we're correcting any of those nutrient deficiencies. Those are good places to start for cardiovascular, stuff. But I'm curious from a Chinese perspective, what do you usually kind of start with?
So one thing, acupuncture is obviously going to be really good for blood flow. It's good for reducing inflammation, which is huge. You were talking about earlier inflammation in the blood cell or in the blood vessels, and acupuncture is going to help with inflammation, and it's just going to help with that stress. The anxiety stress component. It's going to be
Mm-hmm.
big. Um, I don't focus. There are some good supplements and herbs. I usually like to work with a naturopath on this, but just because there are great Chinese herbal formulas that have been used for thousands of years for this, but you also have to be careful not to let them interact if somebody needs to be on a medication.
Mm-hmm.
So it's a very delicate balance. And if I have any question that balance can be upset, then I'm going to go kind of a safer route on that, just because I don't like to take a lot of chances. I actually love antioxidants. That's going
Mm-hmm.
to be one of my first lines. I know it's not Chinese medicine, but I absolutely love, vitamin D is something I'm going to be pushing, vitamin A, vitamin C, resveratrol, so Japanese knotweed is a really, really good thing
Mm-hmm.
that people can add in that's just going to help with antioxidants, as well as what we've been talking about. So I know it's not very Chinese answer, but I really like these just because we were talking about low hanging fruit. And these are like a lot easier for a lot of patients who may not be willing to take a big step into like, you need to take this formula 3 times a day in powder form every single day for a
Mm-hmm.
month. What I found over time is that even if there's not interactions, getting people to do that, hey, are you taking that every day? Is like, well, like I remember
Mm-hmm.
sometimes, which means they're almost never taking it.
Right.
Um,
Yeah.
so picking something that's super easy that that they're going to be able to do. And I'm not a big fan of bad supplements. I hate to say bad supplements. There are bad supplements out there, but
Mhm.
like if somebody's going to get a supplement, it's like if you actually want to take it, then make sure it's a good quality, that you actually know that what they say is in it is in it.
Mhm.
So order through your acupuncturist, through your naturopath, through somewhere that has independent testing so that you know what you're actually getting in your body.
Mhm.
That's a big one too, because I'll have somebody tell me I went and got the jumbo size of multivitamin from the store, and you look
Mhm.
at the percentages, right? And the multivitamins are doing them no good because they're at subclinical levels, and you
Yep.
don't know where they're sourced, and they're pressed into this tiny pill that you're not even digesting well, anyways.
Yep.
So,
Yeah. Great
so I'll
points, man.
push, yeah. So I will push for people to spend a little extra money and get something where you actually know what you're getting. When you're taking your multi, okay, I'm getting 500% of my B6, and I'm getting, it'll say, 10,000% of your B12. And you're like, oh my gosh, but it's just because
Mhm.
the recommendation levels are so low.
Yeah.
Um, so, anyways, those are the things I like to focus on, and working with a naturopath, with the doctor, to make sure everybody's on the same page.
Yeah, that's great. I want to give a personal kind of snippet here, real quick, just about acupuncture and decreasing stress. Like I found it personally, and with my patients, that this is one of the most profound things you can do to help manage stress. Now, if you've listened to this podcast before, I've told you, like, I've struggled with panic attacks and anxiety in the past, and really it's been and even increased blood pressure due to that increased sort of stress response. um, and acupuncture, honestly, for me, outworks like medication every time. Like if I
Mm.
just consistently did acupuncture, it would keep my nervous system, much more balanced, and I wouldn't need medication to manage my blood pressure, and because it was driven by that stress response. And so once I better managed that stress response, didn't need the medication because that was the only reason for the blood pressure going up. So I'm a big fan of acupuncture.
Thank you for sharing. That's really cool. Yeah, it's helped me a lot too. And it seems counterintuitive, because you look at it and you're like, oh, like it's needles. There's no way this is going to feel good, but it actually
Uh-huh.
does help quite a bit. So,
It does. Yeah, absolutely. All right, man. Let's wrap it up. Anything else you could think of
yeah,
that you
I
want
just
to
want to
drop
say thanks for
before?
sticking with us. We went longer than usual, but
Yeah.
it's a big topic that's killing a lot of people. And
Yeah.
I just want to say, if you came out of this a little scared, that's okay,
Yeah.
because you can go and start to do some work on this. So,
Mhm. Yeah. 100%. Yeah. You should be a little scared. There's good reason for it.
I'm a
Guys are
little
dropping.
scared.
Yeah, me too. Absolutely. Same here. Yeah, yeah. I'm at times more than just a little, concerned and scared, which I think can be healthy to some extent. It's a good motivator and driver for you to make change, right? And
Mhm.
that's really what we need to do right now is make change.
Yeah, well, thank you for your expertise, man. This was great, and I just love hearing your
Likewise.
perspective. So appreciate
Yeah,
it.
likewise too, man. Good times. Great show. Yeah. Anything else?
Nope. Tune in next time, and you get to hear even more great info. So
There you go. All right, guys. Till next time, be healthy. Take care.
peace.